Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother, Dr. Stephen Nedd, for this week's body chat about eye health and vision problems. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen in to our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good evening, Steve.
Good evening, Ron.
Today, we get to talk about vision and eye care and things that you don't typically deal with, but is information that will be helpful to people. So first of all, what are the most common eye and vision related conditions that respond to alternative treatment like nutrition and or exercise?
Well, that would be nearsightedness and farsightedness.
Okay.
Night blindness. Cataracts. Macular degeneration. Diabetic retinopathy. Glaucoma. Pink eye, which is also known as conjunctivitis. Eye infections. Dry eye syndrome, migraines with auras of the eye, and also ocular migraines.
Okay.
Yeah.
So those are various different ones that you know of that do respond to alternative type treatments.
Yes, and just for people's information, I'm sure everybody's heard of macular degeneration, but they may not know what it actually is. So I thought I'd define that so that we can move on from there.
Good.
Macular degeneration is a deterioration of a part of the retina of the eye called the macula, and it's the leading cause of vision loss in the United States, with over 10 million people affected by it, and that's more than cataracts and glaucoma combined.
Okay.
And it's typically due to the aging process.
All right. Well, good. Well, we'll get into that along the way, probably some more. Now, why is vitamin A so important for healthy eyes?
Well, it plays an ultra important role in your vision. So in order to see the full spectrum of light, all the different colors, your eye needs to produce certain pigments for the light receptor cells in your retina to work properly.
Okay.
And when you have a deficiency of vitamin A, then that stops the production of these pigments, and that will lead to night blindness too. And speaking of night blindness, it's one of the first signs of a vitamin A deficiency.
Is it really?
Yeah. And all the way back in ancient Egypt, it was discovered that night blindness could be cured by eating liver, which later was found to be rich in, of course, vitamin A.
Yeah.
That's
interesting.
And your eye also needs vitamin A to nourish other parts of your eye, including the cornea, which is the clear covering on the front of your eye. And without enough vitamin A, your eyes cannot produce enough moisture to keep them properly lubricated. And this can also lead to clouding of the front of the eye, ulcers of the cornea, and vision loss. Now, vitamin A deficiency is the leading cause of preventable blindness in children worldwide. It's really rare in the United States, but worldwide, there's an estimated 250 to 500,000 children that become blind every year because of vitamin A deficiency. And unfortunately, half of these children end up dying within a year of losing their sight.
Wow.
Yeah. One really important thing about A is that it's important that you take the right form and the right amount of vitamin A, because too much of the wrong type can cause toxicity issues and disrupt vitamin D absorption.
Okay, so what is the right type and how much?
Well, the right type would be beta-carotene if you're going to take it as a supplement form. And I'll get into some of the food-based forms in a second.
Okay.
So yeah, really you should get most of your vitamin A from your diet, and the best meat and dairy sources are pasture-raised beef or duck liver, eggs from organic pasture chickens, raw organic butter and cheese from grass-fed cows, whole raw milk and heavy cream from organic grass-fed cows also, and then you can get shrimp, preferably not farm-raised, as well as fatty fish like wild-caught salmon, and to a lesser degree, sardines.
Okay.
As far as the best vegetarian sources, organic orange and yellow fruits and dark leafy green vegetables are your best sources of vitamin A.
All right. And since a lot of people aren't able to get quite enough from their diet, you said that beta carotene is the best supplement.
Yeah, it's the safest. It's not a fat-based form, so it won't create toxicity issues like the fatty retinoic acid form that you typically see in like 10,000 or 20,000 IU pearls. Too much of this fatty form can cause liver toxicity as well as block the activity of vitamin D. And chronic excessive intake of this can lead to hair loss, confusion, and bone loss.
Okay. That was the form that I think Dad was taking in high doses.
That's right.
Okay.
Right.
So it would have been better. But back then, I don't think beta carotene was even being sold as a supplement.
Yeah, it was kind of in its infancy because there wasn't as much research out. And and another thing that people used to take a long time ago, and it's kind of made a comeback, is cod liver oil.
Mm-hmm.
And the reason is it contains both vitamin A and D, and it sounds like a great idea to supplement with. But however, recent research has found that the ratio of vitamin A and D in cod liver oil is not optimal and can actually be detrimental to your health. So I'm actually telling you not to supplement with cod liver oil.
All right. And that's different than the type of fish oil that we talked about before and we're going to talk about next week?
Yes.
Okay.
Yep.
Which next week we're going to be talking about the omega-3, 6s, and 9s.
Yes.
Okay.
So in general, stick with beta carotene if you're going to supplement. It's not the active form of vitamin A, so the body won't convert more than it needs, so that you won't have toxicity issues. But the only drawback is that some people basically can't convert beta carotene to active vitamin A, and this includes infants, diabetics, people with alcoholic liver disease, people that are on very low-fat diets, and people with compromised bile production from the liver and gallbladder, as well as people with hypothyroidism. So in this case, they should try to get it from animal sources or supplement with the fat-based form in reasonable amounts like 5 to 10,000 IUs per day.
So not mega doses.
Right.
Okay, good. So that would be something that wouldn't be bad for somebody that comes in to see you to check or ask you to check on whether they should be taking the fat-based form or the beta-carotene form.
That's right.
Okay.
And I want to get into vitamin D a little bit more because we just mentioned it, because it's also critical for eye health. And deficiency has been associated with dry eye syndrome and age-related macular degeneration.
Okay.
I want to get into that a little bit more. I'd also like to talk about how it's related to autism. And I know this is a little off topic, but autistic children typically have quite a few number of eye conditions.
Mm-hmm.
And that includes sensitivity to light, crossed eyes, poor vision overall.
Mm-hmm.
And numerous studies show that the majority of autistic children have vitamin D deficiencies. And when they're supplemented with vitamin D, they improve dramatically.
Wow.
Yeah.
There's
also, I know. There's also studies that show that the development of autism could also be related to vitamin D deficiency. And in fact, there's a study that came out last year that showed that children born to women who had low blood levels of vitamin D while pregnant more than double their risk of autism. Yeah. So that's another one in addition to the possibility of vaccine exposure and so forth. The rate of autism is now, I think it's 1 in 50 children.
Wow.
That's incredible. Yeah. Another reason I brought this up is because it reminded me of an incredible success story that Dr. Jeffrey Bland, who's known as the father of functional medicine, which is also known as restorative medicine, he gave a seminar I attended 15 years ago, and he went over an unbelievable success story with a little girl that was autistic, and I wanted to share this.
Okay.
So what he did was he worked with the mother, with the little girl, and one of the things that he put her on was real high doses of vitamin D, as well as, a number of other supplements, but the D was the key ingredient here. And so he gets a phone call from her, I don't know, maybe it's a few months later on after she started the program. And the mother said, something extraordinary happened this morning. So I went into her room to get her ready for her day. And she actually looked at me for the first time directly. And even more extraordinary than that was she talked for the first time and said, "Mommy, I'm so sorry. I haven't been able to talk to you all this time."
Wow.
Yeah. I mean, there wasn't a dry eye in that room when he told this. It was, wow.
I imagine.
Yeah.
Very cool.
Mm-hmm. Okay, yeah, getting back to vitamin D again, in particular vitamin D3, it's critical for eye health overall, and a deficiency has been associated with dry eye syndrome and age-related macular degeneration.
Okay, good. So then that's pretty key to proper eye health and vision.
Exactly.
All right, good. Now, for eye infections or conjunctivitis, which is, as you said, it's an inflammation of the outer covering of the eyeball, what have you found that are some of the best alternative treatments?
Well, first of all, before you try any of these things, it's really important that you always wash your hands before applying any remedy to your eye to prevent spreading any more infection to the eye.
Okay.
Okay. Now, first of all, simply just use a warm compress. A warm compress can treat an eye infection like an eye sty or conjunctivitis and help clear the infection out quicker.
Okay.
What happens is the warmth from the compress helps to increase blood flow to the infected eye, which may speed up the healing process.
Mm.
And even doctors from Mayo Clinic recommend using a warm compress to treat pink eye infections now. So the way you do it is first you soak a clean, lint-free cloth in warm water and wring out the excess.
Mm-hmm.
And then you keep your eyes closed and apply the warm compress to the infected eye several times a day.
Okay.
And, just repeat this until the eye infection is gone completely. And if you happen to have it in both eyes, you should use a different clean cloth for each eye to prevent spreading infection from one eye to the other.
Okay, that's good to know.
Yeah. If your eye's inflamed, then you can also try a soothing cool compress for instant relief from itchy, scratchy eyes also. Now, another neat thing that you can use is tea bags.
How would you use those?
Well, they're a great way to help treat an eye infection at home because old bags you can use to make compresses since the tea contains soothing properties to help reduce inflammation and irritation caused by eye infections.
Okay.
And they can also help drain pus from the eye, like from styes, and prevent the infection from getting worse. So what you do is you use either like a black or green tea bag and dip it into hot water and leave for about 5 minutes.
Mm-hmm.
And then you press out the excess moisture and make sure that the tea bag isn't hot when you're about to use it. And then you just place it on your infected eye with your eye closed, obviously, and hold for a few minutes at a time.
Mm-hmm.
And then just repeat it every day until the irritation, discharge, and any other signs of the infection have gone for good.
Okay.
Yeah, that one's been used for a long time.
Yeah, I would think so.
Yeah. Another thing that works is called Eyebright. And this is a natural herb that's been traditionally used for treating eye infections, including conjunctivitis.
Mm-hmm.
And there's actually quite a few medical studies that back this up. And it can also help to protect your eyesight and prevent vision problems when it's taken as an oral supplement.
Really?
Yeah.
So that would be almost a preventative supplement or a vision maintenance supplement?
Mm-hmm.
Okay.
And if you do have an eye infection, you can purchase the homeopathic remedy called Euphrasia, EUPHRASIA, which has Eyebright in it. And then you just apply 1 drop to your eye about 3 times a day until the infection's gone. It works great.
Excellent.
Another unique one is organic honey, in particular Manuka honey. And there's a study from 2016 in Germany that found that honey could help prevent dry eye disorders and help kill off infection-causing bacteria in the eye.
Now, is this taken orally or do you put it on your eyes?
Well, what you do is you mix equal parts of honey with distilled or purified water, and then using a cotton ball, you apply the natural honey remedy to the infected eye and do this like 2 or 3 times a day until the infection clears.
Okay.
Yeah.
Interesting.
Mm-hmm. Yeah, I've got a few more here.
Go ahead.
So a saline eye wash is also good because salt helps to balance the pH levels in your eye, and this reduces itching and irritation. And saline solutions are also naturally antibacterial, and they help remove infections and also prevent them from spreading. And there was a medical report that showed that warm saline solution is the best kind of solution to rinse your eyes.
Wow.
So, yeah, so with that in mind, it's better that you make your own than buy, for instance, saline solution for contact lenses.
Oh, really?
Yeah.
What's
so here's
the
how you make it.
Between the two? Oh, you're going to tell us.
Yeah, because you need to warm it up. And so, this way you can make your own. And what you do is you mix a teaspoon of salt in a cup of water, and then you boil the salt solution and leave it to cool until it's warm.
Okay.
And then use an eye bath, which is like an eye cup that you put to hold it there, and then you rinse the infected eye with that.
Okay.
And then you repeat it, about 2-3 times a day until all the symptoms of the infection are gone.
Okay, good.
Yeah, so a simple, inexpensive approach there. Another one is the supplement from Standard Process called iPlex that I've used successfully for many years. And it's not only good for eye infections, but other conditions like macular degeneration, cataracts, and glaucoma. And I typically recommend 6 per day of that one.
And that's spelled IPLEX, isn't it?
Yes.
Okay.
And then my favorite is colloidal silver. You not only can take colloidal silver orally as a supplement, but you can also safely put drops of it into your eyes. Mm-hmm. Now, I can't say that is true for all brands, but the one I recommend the most is called Silver Water, and we carry it. You can also get it on Amazon. And colloidal silver has been found to handle over 650 types of infections, too.
Wow.
Yeah.
So they're selling it on Amazon now?
Mm-hmm.
Selling everything on Amazon now.
I know they are. And then the final thing is acupuncture, believe it or not. There's several points around the eyes, like on either side of the eyebrow and on the cheekbone just below the eye and base of your skull and on the thumb index web where large intestine 4 is. I mean, these points are amazing. I've had great success with them, not only treating myself, but also my patients. And I remember back in college, right after I learned how to do acupuncture, I had this really bad eye irritation. It might have been an infection. And being a poor student, I couldn't go to see the doctor or anything. So I just took some needles and did those points. And I'm telling you, within minutes, it was better.
Wow.
And so several times since then, I've had, especially when I used to wear contacts, my eyes would get irritated. And that was the only thing that gave me relief.
That's great. Mm-hmm. All right. And I think what I'm going to do is ask you to put together a list of the various different supplements you went over in this part and any other parts, so that we can have that list available for listeners if they want to as a link in the podcast notes.
Sure.
Perfect. So now let's move on to something else. What are cataracts? What causes them? Is there anything that can be done to prevent them? Mom had them. I don't think anything ever got done with that because it was almost toward the end of her life. But I remember it was like very difficult for her to read because it was foggy and it was a problem. So what did you find out about that?
Well, a cataract is a clouding of the eye's natural lens, which lies behind the iris and the pupil. And what happens is light doesn't pass through easily and vision becomes blurry. It's like looking at a fogged up window. Mm-hmm. And cataracts are the most common cause of vision loss in people over age 40 and are the primary cause of blindness in the world. By age 80, more than half of all Americans either have a cataract or have had cataract surgery. And by 95, if you're lucky to make it that long, the percentage increases to nearly 100%.
Wow, that's a huge number.
I know. So what causes it? Most cataracts develop when either aging or injury changes the tissue that makes up your eye's lenses.
Okay.
And there's also some inherited genetic disorders that can cause health problems that can increase your risk. It can also be caused by other eye conditions, past eye surgeries, or medical conditions such as diabetes. Mm-hmm. And there's medications, including statin drugs. Big surprise.
There they are again.
Yep. Hormone replacement therapy and long-term use of steroid medications can also increase your risk for cataracts.
Okay.
Now, as far as prevention, the most important thing is get your eyes checked on a regular basis, because if you catch it in the earlier stages, you can do something about it. And going back to Mom, she had one that was full-blown that she actually had surgery on.
Okay.
But she had one that we caught in the early stages, and I actually treated it with nutrition and acupuncture, and it never became full-blown.
Interesting.
Yeah. Quitting smoking and reducing excessive alcohol intake definitely reduces your risk. Handling and improving various medical conditions that are risk factors, including diabetes, high blood pressure, and obesity.
Makes sense.
Yep. Wearing sunglasses that block 100% of the UV rays from the sun, since excessive exposure to these rays are another risk factor.
Interesting.
Mm-hmm. Drinking plenty of water to prevent dehydration, since the lens of the eye does not get a blood supply, but it obtains its nutrients from the surrounding fluids, and waste products are also removed through these fluids as well. So you want to make sure it's getting flushed well.
Okay.
And then there's a number of studies that show that certain nutrients and nutritional supplements may reduce your risk for cataracts. And these include vitamin E, vitamin C, omega-3 fatty acids, and the nutrients lutein and zeaxanthin, which we'll cover in more detail later.
Yeah, say that one 10 times fast.
No, I'm lucky that I got it the first time.
Yes, you are. All right, good. Now let's talk about something a little more serious, a detached retina. And that's probably one of the most severe eye conditions that somebody can experience. What are the warning signs that somebody should absolutely never ignore?
Well, first of all, retinal detachment itself is painless, but warning signs almost always appear before it occurs or has advanced. And these include the sudden increase in size of floaters.
Okay.
And floaters, as you know, are tiny specks that seem to drift through your field of vision. Okay. The sudden appearance of flashes of light in one or both eyes.
Mm-hmm.
Blurred vision is another thing, as well as gradually reduced peripheral vision.
Mm-hmm.
And a curtain-like shadow over your visual field. Yeah. So retinal detachment is a medical emergency in which you can permanently lose your vision. So you need to seek immediate medical attention if you're experiencing these signs or symptoms that we just went over. And people are at greater risk of developing this if they're over 50. They have had a family member, or they've actually had one of their eyes with a detached retina.
Mm-hmm.
Or if they're extremely nearsighted.
Yeah. Interesting.
Mm-hmm.
Okay. So that's something you definitely don't want to mess around with. So go over the symptoms, the main things that people should watch out for as far as warning signs again.
Okay. Sudden increase in size of floaters. Sudden appearance of flashes of light in one or both eyes. If your vision starts to get blurry. Gradually reduced side vision, also known as peripheral vision. And if you get like this curtain-like shadow over your visual field.
Okay, good. So just make sure if those things happen to go and get your eyes checked out immediately.
Yes.
Now, what other nutrients are good for eye health, and what is the best source for them?
All right. So we've already covered vitamin A, vitamin D, Eyebright, Eyeplex, and colloidal silver. So we've got a bunch more to go over.
Okay.
Okay. So vitamin C with bioflavonoids. Now, you don't want to just buy vitamin C or ascorbic acid. You want to get them combined. It's better.
Right.
And these are good for reducing the risk of cataracts and macular degeneration. So the best food sources for vitamin C are red and green peppers, kale, strawberries, broccoli, oranges, and cantaloupe.
Okay.
The best food sources for bioflavonoids are tea, red wine, citrus fruits, blueberries, and cherries.
Interesting.
Yeah. I think the only thing they have in common is citrus fruits.
Yeah, exactly. That makes sense.
Yeah. Now, vitamin E, when combined with beta-carotene and vitamin C, can also help reduce the risk of macular degeneration. And when you supplement with E, the best source is what are called the mixed tocopherols, and you need to take at least 400 international units per day, but I prefer 800 IUs per day.
It's funny, the mixed tocopherols, when you said that, I got this immediate picture of a wedding band with a bunch of guys with the ruffled shirts and tuxedo type thing playing. It's, hey, welcome the mixed tocopherols, who are going to play Blondie and Michael Bolton. Okay, go ahead, continue.
Yeah, so the best food sources of vitamin E are almonds, sunflower seeds, and hazelnuts.
Okay.
All right. Omega-3 fatty acids. Yeah, I know we're going to cover this next episode, but they can actually prevent macular degeneration and dry eyes. And you can supplement with either fish oil or flaxseed oil. Mm-hmm. And the best food sources are cold water fish, salmon or herring. And I would avoid mackerel, even though they recommend it because it is high in mercury.
Okay.
Being a fisherman, I know these things.
Yep, that's true. Yep. And tell everybody your favorite source of omega-3.
Yeah, Carlson's Finest fish oil is my favorite. It's from Norway, and they do the best process of eliminating any toxins that could possibly be in it, including mercury and pesticides and things like that.
Yep, and they have a version with orange and a version with lemon to kind of cut the taste, and it doesn't taste fishy at all.
That's right. So the best vegetarian sources for omega-3s are ground flax seeds and walnuts.
Great.
Yeah. Now, zinc works with vitamin A to reduce the risk of night blindness and can also reduce the risk of macular degeneration. And studies have actually shown that vitamin A requires zinc to support healthy vision. So now if you're going to be supplementing with A, make sure you're also getting some zinc too.
All right.
And the best food sources of zinc are oysters, beef, Dungeness crab, and dark meat turkey.
Okay.
And the best vegetarian sources are beans, nuts, and oats.
All right.
So getting to the funky words, lutein and zeaxanthin.
Okay.
These are nutrients that when consumed in food or supplement form and taken along with vitamin E can significantly decrease the risk of cataracts and can also reduce the risk for macular degeneration too. And the best food sources are spinach, kale, turnip greens, collard greens, and squash.
All right.
Now, one more thing about vitamin D.
Well, before you go into vitamin D, is the lutein and the zeaxanthin thing?
Zeaxanthin.
Whatever that's called. So those two things, are they in iPlex or any of the other supplements?
They're not in iPlex, but they're in the same family as beta-carotene. And again, as you can see, they're pretty much in vegetables.
Okay. All right, good. So then you were just about to talk about...
Yeah, and there's one more thing about vitamin D that I wanted to bring up. The National Institutes of Health say that sunscreens block vitamin D producing sun rays and suggest that a little sun without sunscreen is good. And on their website, they say that approximately 5 to 30 minutes of sun exposure between 10 a.m. and 3 p.m. at least twice a week to the face, arms, legs, or back without sunscreen usually lead to sufficient vitamin D synthesis or production.
Okay, good. Good.
So that's good to know. Yeah, so on the whole, sun overexposure is the real problem when it comes to raising your risk for skin cancer. So it's very important to get some sun exposure and not avoid it altogether. So in other words, after getting a little bit of sun exposure, then add the sunscreen.
Okay, I can see that. Very good. Now, what other activities and actions should people be sure to avoid in order to protect their eyes and vision?
Okay, number one would be wear sunglasses that block 100% of the ultraviolet rays, because that will not only help prevent cataracts, like we went over earlier, but also save you from cornea and retinal damage.
Okay.
Also, when it comes to wearing something, proper eye protection to help prevent eye injuries. There's 2.5 million eye injuries per year in the United States.
Wow.
Yeah, and this is especially important for sports like hockey, baseball, swimming, and racquetball. And home activities like yard work, such as lawn mowing, trimming hedges, tree branches, using an electric saw for cutting wood or pipes, and mixing chemicals.
So when people do those types of things, they should have some type of eye protection. Okay.
Yep. I was trimming my trees last weekend, and I had a pole chainsaw, and I had my protective goggles on.
Good for you.
Yeah. This one's really important, and most people have no idea about this, and that is computer vision syndrome, also known as digital eye strain.
Okay.
So according to a 2015 survey by the Vision Council, 65% of American adults reported having symptoms of digital eye strain.
All right. And what are the symptoms?
Well, that would include obviously eye strain, but also eye fatigue, headaches, irritated eyes, and blurry vision. And this is caused by 3 issues.
All right. What are they? Oh, or do I get to guess?
Go for it.
Number 1 is too many hours in front of a computer. Number 2 is the wrong kind of monitor. Number 3 is having the air conditioning blowing directly on your eyes and drying them out. Did I get anything?
No.
Okay.
So the first one is blue light. And this is something that digital devices emit, and it irritates the eyes.
That's interesting, because Elsa was talking about the Plant Paradox book. And one of the things that he recommends in there, And it has more to do with sleep, but he said there's an app that you can get so that if you're reading on your iPad at night, you get amber color light instead of blue light.
Mm-hmm.
So that's interesting how that might have some relation to it.
Yeah. In addition to that, blue light can also suppress your melatonin secretion, which helps us fall asleep at night. So using digital devices at night can therefore lead to it being harder to fall asleep and make sleep quality even poorer. So don't use your phone before going to bed, in other words.
All right. Well, I'll have to check into that app and we'll have to talk about it at some point later because I want to try that out.
Yeah. Okay. So the second thing is glare. And that's basically unnecessary feedback that enters into the eyes, causing issues like eye strain and headaches.
Okay.
And the third one is up close viewing. Our eyes are not designed to stare at any object up close for long periods of time.
Okay.
And so looking at something like a phone, a tablet, or a computer, which is generally 18 to 24 inches away from us, stresses the eyes and can lead to eye fatigue, blurry vision, and headaches as well.
Okay.
Yeah. So there are workable solutions to this issue.
Get like a 60-inch monitor and put it 3 feet away from you.
No, well, I mean, that's a possibility, but it's not one of the things I would recommend.
Okay. Well, what would you recommend then?
All right. The first one is called the 20-20-20 rule. And this is actually widely recommended by eye doctors.
Mm-hmm.
And what it is every 20 minutes, you look away from your screen and stare at something 20 feet away for 20 seconds.
Ah, okay.
And what that does is it reduces stress on your eye, and it can also combat the negative effects of digital devices.
All right.
Okay, good. The second thing is computer glasses. And these have lenses that filter blue light and eliminate glare. And obviously, if you are farsighted, then your lenses can include vision magnification in even 2 or 3 levels. So that would be bifocals or trifocals, which are now nicely called progressive lenses.
So are these sold under the name of computer glasses?
Mm-hmm.
Okay. So if people want to find them, they can do a search for computer glasses.
That's right.
Interesting.
Yeah. Another thing you can do is improve the lighting of the screen you're using by adjusting your display settings, as well as the surrounding room lighting to reduce glare and eye strain. And you can also get an anti-glare screen for your computer monitor.
Okay.
And then improve your workstation ergonomics.
Now, in what way would that be done for the vision thing? We talked about for the back and the desks that rise up and down.
Okay, so there's several things. The first one is when you look back and forth between a printed page and your computer screen, that can cause eye strain. So one way of remedying that is you place the written pages on a copy stand next to the monitor.
Mm-hmm.
You don't have to keep looking down and up. Poor posture during computer work also contributes to computer vision syndrome. So adjust your workstation and chair to the correct height and consider using a standing adjustable desk. And obviously you can refer to our podcast, Computer Slouch and Text Neck, for more detailed info on this.
That's right.
And another thing that we covered in that episode that's relevant here is the distance between you and the computer monitor, which should be about an arm's length away and which is no closer than 20 inches away. And the height of the monitor should be adjusted so that the top of the screen is at or slightly below eye level so that your eyes are looking slightly downward when you're viewing the middle of the screen.
Okay.
Yeah.
That doesn't work on mine because I have that little shelf there, but I did move it down as far as it'll go.
Okay, good job.
Yeah. Now, is there anything you can do to improve your vision other than getting glasses?
Well, yeah, way back in 1920, there was a doctor named William Bates who wrote a book called Perfect Sight Without Glasses. And in it, he questioned whether glasses were the only way to fix a person's vision. And he decided that they weren't and created what's called the Bates method. And it's a way for people to improve their sight without glasses. And it's actually still used today. There's lots of success stories. A lot of it's anecdotal, but they haven't done any studies really to show that it really works.
Okay.
Yeah.
So people can look that up, the Bates method. Mm-hmm. Not the Bates Motel, the Bates method.
I knew that was coming.
You could have guessed that.
Yeah. So there's other similar methods, and most of them involve various eye exercises and supplementing with many of the nutrients that we've already covered.
Okay, that's good to know.
Yeah.
So people can look those things up and try to do something about that rather than just becoming dependent upon glasses.
Yeah. And you remember our father actually corrected his vision and night blindness in his 50s by doing specific eye exercises and taking large doses of vitamin A.
Right.
And these eye exercises included rubbing pressure points at the junction of the collarbone and breastbone while moving the eyes in various directions, including up and down, left and right, and clockwise and counterclockwise.
Okay.
I'm afraid that it's possible that his chronic high-dose vitamin A intake may have helped his eyes, but at the same time may have also left him vulnerable for skin cancer, which he developed later on and succumbed to. And if you remember, high doses of fat-based vitamin A can block vitamin D activity and can also cause liver toxicity. And I remember his liver enzymes were usually pretty high when he had his blood test performed. And that was someone who never drank or smoked his entire life.
Right.
And there are studies that show that there's 16 types of cancer that vitamin D can help prevent. So when you're deficient in it, it leaves you vulnerable to them.
That's a good point.
Yeah.
All right. Well, that was one of those things that it's probably good we didn't listen to him about.
Yeah.
Now, is there anything else you'd like to say before we end?
Yeah, I'd like to talk to you about another eye condition that you would never think that a chiropractor could help, and that is glaucoma.
So why don't you tell us what glaucoma is?
Well, it's a condition that occurs due to increased fluid pressure in the eye, resulting in damage to the optic nerve, which transmits visual images to the brain.
Okay.
And if it's left untreated, it can lead to permanent blindness within a few years.
Wow.
Yeah. The trouble with glaucoma is that most people with it have no early symptoms or pain, so it's very important that you see your eye doctor regularly so that he or she can diagnose and treat it before long-term visual loss happens.
That's the little puff test they do, isn't it?
Mm-hmm.
Okay.
Yep. It's kind of annoying, but it's necessary.
Mm-hmm.
Typical medical treatments include eye drops and or surgery to improve fluid drainage to reduce the eye pressure.
All right, but you said that this is something that an alternative method could help.
Yeah, I've had quite a few patients that I've helped with this.
Okay, what did you do?
Well, so the normal eye pressure should be between 12 and 22 millimeters of mercury, with greater than 22 being abnormal and under 20 being optimal. And I had one patient whose levels were in the high 20s. But after receiving chiropractic adjustments along with acupuncture around the eyes and the back of the neck, like I explained I used to do on myself, his levels dropped back down below 20 relatively quickly, and they stayed normal for quite a while.
That's great. Much better way of going about it than surgery.
Oh, yeah. The part of the spine that actually controls the optic nerve is the second vertebra in your neck, called the axis. Yeah, so that's something I always look for when somebody comes in with any eye condition.
Well, great. So that's good information. It's good to know about. So we've got glaucoma. We talked about cataracts. We talked about just general vision type things and eye conditions like infections and conjunctivitis and so on. And you'll be putting together a list of various different supplements and things that they're good for. Awesome. So thanks for going over all of that, Steve. That's very helpful. I know it's not the typical thing that you deal with in your practice, but at the same time, it's something that a lot of people have difficulties with. So it's helpful for all those people. And next week, we're going to get into a topic that ties into this, and that has to do with the omega fatty acids, the 3s, the 6s, and the 9s, which are the good numbers and which are the bad numbers. So we're going to cover that next week. And until then, thanks again.
You're welcome. And happy Easter.
And happy Passover.
Okay.
All right. Bye.
Bye-bye.
Thanks for joining us this week on the Body Chat Podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week, and if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat Podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.